In this lecture, we will discuss right-sided leads, including their placement and clinical significance. The right-sided leads are not part of the standard 12-lead ECG. Rather, they are additional precordial leads that can be useful in diagnosing right ventricular infarcts, which are not uncommon in the setting of inferior infarcts. Let's first orient ourselves here. So notice we have the right side, okay? This is our left side. Okay, imagine the patient's looking at you. This is the posterior aspect, and this is the anterior aspect. This is our heart here in red. We have our left ventricle that's more posterior. And remember, the most anterior portion of the heart is our right ventricle that sits here. Okay, so again, posteriorly, we have the left ventricle. All right, notice it's much larger, and then the right ventricle here is, again, more anterior. All right, so why can these right-sided leads help in the diagnosis of right ventricular infarcts? Well, it's because the vector of the right ventricle points anterior and to the right. Therefore, direct changes will clearly be seen in the right-sided leads. So the right-sided leads are V3R, V4R, V5R, and V6R, okay? And they're labeled here. So here's our right-sided leads, V3R, V4R, V5R, and V6R. And what we're saying here is during an infarct, here's our right ventricle, things are directed anteriorly and to the right. Here's our right, okay, so this way. So if we have an infarct in that area, we'll be seeing the vector heading in this direction, okay? And in that direction is where these right-sided leads are, okay? So as you can see, the right-sided chest leads give us a right lateral view of the heart. Now notice the placement of the right-sided leads. They are placed in the same position as the leads V3, V4, V5, and V6, but now they're on the right side of the chest. In other words, they are a mirror image of those leads. This is why they're referred to as leads V3R, V4R, V5R, and V6R, and the R stands for right, or right-sided leads, okay? So if you look here, again, we'll erase some of this stuff, clear it up. And what we're saying here, if you look on our chest, we have V1, V2, V3, V4, V5, V6, okay? This is the standard lead placement. And then we're looking at the right-sided placement, okay? And what we do on the right-sided placement is, if you imagine, here's where V6 is, okay? We're putting it directly opposite. Here's V5, okay? And V5 will be opposite. V4, okay? Notice how we're going from the left side, okay? And we're putting things on the right side. So it's a mirror image of it, all right? So everything we see here on these right-sided leads is a mirror image, okay? Even the fact that here's V1, all right? And V1R will be on now the left side, okay? Let's erase some of this here so you can see. Okay, then we have V2 here on the left side, all right? And then in the right side, it's going to be here. So that's V2R. Then V3R, V4R, V5R, and V6. Okay, so notice how they're simply mirror images of the normal standard precordial leads. So again, the right-sided leads, V3R, V4R, V5R, and V6R, is simply mirror images of V3, V4, V5, and V6 respectively. Now, just a few clinical points here. We mentioned that they could help in the diagnosis of right-sided infarcts. In such cases, we would see ST elevation in those leads. And the key thing to remember is because they are not present in our standard leads, we need to order these right-sided leads. And the time to get them is in the presence of an inferior infarct. With an inferior infarct, we'll see acute injury changes in the inferior leads, 2, 3, and AVF, as well as reciprocal changes in the lateral leads, 1 and AVL. So if an inferior infarct is present, consider getting right-sided leads, okay? So let's briefly review what we discussed before we end. So these right-sided leads, okay, V3R up until V6R, okay, they provide a right lateral view of the heart. Here's our right side. We're getting a right picture of the heart. They're a mirror image, okay? Imagine we cut this in the mirror. So here's V6R, here's V6, okay? V5R, V5, V4R, V4, V3R, V3, and this would be V2R, and this would be V1R. Okay, so imagine they're just a mirror image where we're just cutting things and putting them directly on the right side now. And we said to consider these in the setting of an inferior infarct, okay? And that's because right ventricle, it can often be involved in the setting of an inferior infarct. And remember, right ventricular infarcts are preload dependent, so it can change our management. Now, this is useful, as we said, in the diagnosis of a right ventricular MI, okay? And why is that? Because remember, the right ventricle is here, and the force is going to go both anterior and rightward, okay, so in this direction, which is towards those leads, okay, so V4R is quite a good lead to get an idea if there's anything going on in the right side of the heart. Well, that's the end of this lecture. We discussed right-sided leads, including their placement and clinical significance. I hope you learned something.